In this video, we'll discuss about blood transfusion reaction. How to define blood transfusion reaction? It is an adverse effect associated with the transfusion of whole blood or one of its component. So, blood transfusion reaction are defined as adverse event associated with the transfusion of whole blood or one of the component. Whole blood or its component such as packed red blood cell, whole blood, fresh frozen plasma, platelet and cryoprecipitate. Reaction severity may range from minor to life-threatening stage. What are the type of transfusion reaction? Acute and delayed hemolytic reaction, febrile non-hemolytic reaction, anaphylactic reaction, bacterial transfusion reaction, then circulatory overload and hypothermia. So these are the six type of transfusion reaction we want to discuss one by one. Acute and delayed type, febrile non-hemolytic reaction, anaphylactic reaction, bacterial transfusion, circulatory overload and hypothermia. So first one is hemolytic reaction. The reaction occur when the RBC that were given during the transfusion are destroyed by the person's immune system. So what is the meaning by hemolytic reaction? The reaction occur when RBC that were given during transfusion are destroyed by the person immune system. It have acute reaction and delayed reaction. Acute reaction occur within the first few minutes of the transfusion occur. Delayed reaction occur after a or 2 days of the transfusion. Then what are the signs and symptoms of hemolytic reaction? Fever, chills, chest and back pain, headache, shortness of breath, change in the level of consciousness and hypotension. Then how to manage hemolytic reaction, transfusion reaction management? Immediately stop transfusion, then maintain airway, breathing and circulation. Airway and breathing are maintained by measure standing from supplying oxygen to incubation, which depends upon severity of the cases. Supplying oxygen, incubation with depending on that severity of that cases. In the case of circulation, blood pressure is maintained by drugs like noradrenaline or dopamine. Sometimes fluid also administered. So circulation maintained by giving drugs. Then patient required ICU support and hydrated with normal saline. Other management required ICU support and hydrate with normal saline. Then febrile non-hemolytic transfusion reaction. It is a type of transfusion reaction that is associated with fever but not directly with hemolysis. So here not hemolysis, here transfusion reaction associated with fever. What are the sign and symptoms of febrile non-hemolytic transfusion reaction? Fever, flushing, chills, nausea. This one is the most common type of reaction. How to management? Symptomatic treatment, antipyretic drugs administration like paracetamol. Next one is anaphylactic reaction. It is a severe, potentially life-threatening allergic reaction. It is a very rare condition. Sign and symptoms: urticaria, itching, hypotension, chest tightness, bronchospasm, and hypoxia. So what are the sign and symptom for anaphylactic reaction? Urticaria, itching, hypotension, chest tightness, bronchospasm, and hypoxia. How to manage? Immediately stop transfusion, then supportive care including airway management, then administration of epinephrine and adrenaline, then oxygen administration, then antihistamine, cortisone, then beta antagonist such as albuterol they can use. So management. This is all about anaphylactic reaction management. Next one is bacterial transfusion reaction. Bacteria may be introduced into the pack during in the time of blood collection. How bacteria will enter during the time of blood collections? Sources: donor skin, donor bacteremia condition, equipment used during blood collection, and during processing time, chances for bacteria enter inside. What are the sign and symptoms? Fever, chills, hypotension, tachycardia. Then management: immediately stop that transfusion and notify that hospital blood bank. Then supportive care, then blood culture, then broad spectrum of antibiotics. Then circulatory overload, fluid volume excess, and maybe precipitate if blood product is infused too rapidly. What are the signs and symptoms? Dyspnea, hypertension, tachycardia, then distended jugular vein, then changes in the level of consciousness. So these are the signs and symptoms. Then how to manage circulatory overload? Stop that transfusion, administer oxygen, then a diuretic as per the order. Then preventive method: avoid unnecessary fluid and use appropriate infusion rate. Next one is hypothermia condition. Infusion of large volume of stored blood leads to hypothermia. Infusion of large volume of stored blood leads to hypothermia. This one main risk for infant. Preventions: use blood warmer. For infusion of large volume, use blood warmers. Then transfusion reaction, nursing intervention. What is the role for nursing? Stop the transfusion and inform to doctor. Then check that vital sign for every 5 minutes. Then change the intravenous tubing and keep that IV line open with the normal saline. Then closely observe that patient for sign and symptoms. Then prepare to administer emergency medication as prescribed. Then collect urine specimen for that lab studies as per prescribed. Then return blood bag, tubing, attached labels, and transfusion reaction document to the blood bank. Then document the time of event, sign of symptoms, and action taken. So these are the roles nursing for transfusion reaction. So this is all about transfusion reaction. Thanks for watching.